Greetings everyone. This week's video is going to be another scapula intensive video. We're going to show another way to lift the scapula, to work the subscapularis muscles, and to really stretch and work out the rhomboid major and rhomboid minor muscles. So I've done one previous scapula lift, one little technique that I find is a little less invasive. This one's a more aggressive scapular lift technique that you may have seen before, but I'll describe it a lot better throughout the video. So here we go.
Alright, so let's talk about some of the muscles we're going to work on. So we'll put down the overlay, and now we'll see in red we have the teres major. In pink we have the teres minor. And in turquoise we have splenius capitis cervicus. In yellow we see the levator scapulae muscle, and there's a list of the rest of the muscles. So in green we have the infraspinatus, in blue we have the supraspinatus, and orange we have the teres major. So here is technique number one. So after we've properly warmed up the rhomboids, the trapezius muscles, we're going to lightly place the client's arm on their low back, find the acromion process with our thenar eminence, and start to lift the scapula a little bit. Now if we notice that the client is trying to assist us by holding their arm, I like to anchor their hand to the small of their back using my elbow. Now I'm not really applying a lot of pressure to the hand, I'm just securing it there in place as I work those muscles that we listed earlier. Rhomboids, levator scap. Now if you can get under there really well, you can actually work some of the subscapularis muscle. This is going to be more friction. You can use trigger point therapy. I usually use a lot more friction than trigger point in the beginning, and once everything's softened out, I tend to go down and find the trigger points and then do trigger point therapy on them then. So we're going to do the other side of this client so we can get a different angle and see what's going on when we lift the scapula. So arm in the back, secure the hand, lift up on the acromion process, and now we're working the attachment points of all the rhomboid muscles, the insertions of the rhomboids, levator scap. Now you can only really do this too if you have the trapezius muscle properly relaxed. If the trapezius muscle is all tense and spasm, you're really not going to be able to get underneath there to work that other group of muscles. So once again, after we work it, a little effleurage. So here's a review of the muscles we're going to be working on. And after we've warmed up the rhomboids, this technique, we're not going to use the arm in the small of the back. We're going to use more of our own strength to lift up on the acromion process here with our left hand and press in with our right hand, trying to work out those tense muscles, find some trigger points. On this client, found some trigger points near the upper border of the levator scapulae muscle. So we're trying to work our way up to that muscle to work those out. Once again, pushing in, finding trigger points, pushing in, trying to stretch it out a little bit more. And I'll keep doing that until that finally releases, and then move on to the other side of the client. But the biggest difference between the first technique and the second technique is the second technique does require a lot more work as far as the therapist goes, but I feel it's a lot easier on the client.